Hello everyone, welcome back to my channel. I am Dr. Himanshu Dhawan and today we are going to talk about something that can be a little confusing but is essential to understand, especially if you are being diagnosed with varicocele and an epididymal cyst also. So, what should you do if you have both conditions and how can you protect your health? Let's break it down step by step so you can fully understand how to manage it. Before we get into the solution, let's first look at some essential facts. I have got two medical reports on the screen for you. The first report shows a case where a person has both varicocele and epididymal cyst. The second report shows a case where there are only an epididymal cyst without any varicocele. So you will see some details like the size and diameter of the cyst as well as the overall condition. Here's where it gets increasing. Both varicocele and epididymal cyst are the connected, and that's important to understand. One condition can affect the other. You must be thinking how? Well, when the blood flow in the veins of scrotum becomes irregular, as it does in varicocele, it can disrupt the area and lead to the formation of an epididymal cyst. In other cases, the opposite can happen. A cyst can interfere with the blood flow, making the varicocele worse. It's a cycle that can worsen both conditions over the time. Let's simplify this. Imagine the blood flow in your scrotum is like a river. When the river flows smoothly, everything in the area, including your tissues and organs, gets the necessary nutrition and oxygen. But when the flow is disrupted, like it happened with varicocele, it can cause all sorts of problems, including the formation of cyst. The same goes for the cyst. If it interferes with the blood flow, it can worsen the varicocele. It's all about circulation and how blood flow through your veins. So, what should you do if you have both? Here are the most crucial points. If you are dealing with both varicocele and epididymal cyst, your first priority should always be treated the varicocele. The reason for this is simple. A simple epididymal cyst usually doesn't cause any significant issues. Most of the time it's a painless, doesn't cause discomfort and does not affect your overall health significantly. However, varicocele can lead to severe complication. It can cause infertility, lead to testicular pain and even affect of sexual health. If left untreated, it can become a significant problem down the line. So varicocele is one of the leading cause of male infertility. So resolving the varicocele is crucial, not just for your comfort but also your reproductive health. The critical point here is the varicocele is the more serious of the two conditions and should be addressed first. Once the varicocele is under control, you will have more time to deal with the cyst. In most cases, that can be done with simple medication on observations. The treatment for the epididymal cyst is usually less complex than treating varicocele. It's often a much easier task because the cyst doesn't always interfere with the blood flow like a varicocele does. Once the varicocele is taken care of, you will have more flexibility in dealing with the epididymal cyst. Treatment for the cyst is often more straightforward. It could be as easy as monitoring the cyst, taking some medication to manage symptoms, or sometimes a minor procedure to drain it if it caused discomfort. But remember, this is usually not an urgent issue unless the cyst is causing pain or other complications. Now let me quickly address one more thing. If your reports shows only an epididymal cyst, don't worry too much unless it's causing pain or other symptoms. In that case, you can still contact me for advice. Here, what you need to do next is, if you have your medical reports ready, please share them with us by sending them to the number on the screens below. My team and I will contact you as soon as possible to discuss the best treatment plan. If you prefer, you can give us a call. That's all for today's video. This helps clarify some confusion around varicocele and epididymal cyst. Remember, seeking professional advice and treatment early on is always better to avoid complications. If you have any questions or concerns, please drop them in the comments below or contact me directly. Thank you for watching me. Stay healthy and informed. I will see you in the following videos. Namaste.